Prior to inserting a multi-lumen airway, be certain the cuffs hold air and inflate properly. Ensure the blue-tipped syringe has up to 100 milliliters of air drawn into it. Connect it to the blue-colored one-way valve marked number 1. Ensure the white-tipped 20 milliliter syringe has up to 15 milliliters of air drawn up in it, and connect it to the white-colored one-way valve and pilot balloon attached to the tube marked number 2. Lubricate the distal end of the tube with a water-soluble lubricant. From the top of the patient's head, hold the Combitube in one hand so that the distal end curves down and out. Stop ventilations, lift the chin, and begin insertion along the midline. The curve should follow the patient's airway. Gently insert until the ring on the tube is at the level of the patient's teeth. Then inject 100 milliliters of air into the blue-colored one-way valve. Remove the 140 milliliter syringe from the blue valve. After the pharyngeal cuff has been inflated, inject 15 milliliters of air into the white valve using the 20 milliliter syringe. This will inflate the distal tube cuff and help to hold the tube in position. Remove the 20 milliliter syringe from the white one-way valve. Attach the bag valve to the blue tube and begin ventilations. Through the blue tube, auscultate for positive breath sounds. If auscultation is positive, continue. If auscultation is negative, ventilate through tube number 2. If both are negative, deflate the number 1 pilot balloon and extract the tube out 2 to 3 centimeters and reinflate. Determine the fluid and quantity, needles, or needleless catheters. Open the IV kit. Check the name, quantity, and clarity of the IV solution, as well as the expiration date. Remove the protective seal from the port and insert the tube from the drip chamber into the IV bag. Hang the IV bag, run the solution into the drip chamber and IV tubing. Shut off the line and protect the end of the tubing from contamination.